Most students try to memorize obstructive jaundice as separate symptoms, separate investigations, and separate surgeries. But actually, obstructive jaundice is one very logical disease process. If you understand the pathophysiology, then you can predict the symptoms, examination findings, blood results, complications, and even management. So today, let's understand obstructive jaundice clinically like a surgeon, not by memorization. The basic concept that you have to understand is that normally the bile is produced in the liver. Then it travels through the biliary tree and finally enters the duodenum. Bile is very important for bilirubin excretion, fat digestion, and absorption of fat-soluble vitamins. In obstructive jaundice, something blocks this pathway. So, the bile can't enter the intestine. Why jaundice occurs? Now let's think logically. Bilirubin is conjugated in the liver and normally excreted into bile. But when bile flow is obstructed, conjugated bilirubin cannot drain into the intestine. So it refluxes back into the bloodstream. That is why obstructive jaundice causes predominantly conjugated hyperbilirubinemia. So then, why the dark urine? Students often memorize dark urine, but why does this happen? Because conjugated bilirubin is water soluble, so the kidneys filter it into urine. That produces dark urine. Why the pale stools? Normally bilirubin enters the intestine and it becomes stalk bile, which gives stool its brown color. But in obstruction, bilirubin never reaches the intestine, so stools become pale or clay colored. Why pruritus? Why do these patients itch? Because bile salts accumulate in the bloodstream and deposit in the skin. This irritates the nerve endings and causes severe pruritus. That is why you may see scratch marks during examination. Why the steatorrhea and bleeding? Now another important concept. Bile is needed for fat emulsification and absorption. So when the bile can't enter the intestine, the fat absorption decreases. As a result, patients develop bulky, greasy stools, steatorrhea, and deficiencies of fat-soluble vitamins, vitamin A, D, E, K. Vitamin K deficiency is surgically very important because vitamin K is needed to produce clotting factors. So patients develop prolonged VT